What are the best ways to deal with anxiety in children? The best way to deal with anxiety in children depends on whether or not the child is displaying normal childhood fears or a more severe condition such as an anxiety disorder. An adult can typically handle childhood fears with patience and understanding. Talking to the child about his or her anxiety and utilizing age-appropriate tools like books or role-playing can also be beneficial. A child with an anxiety disorder could be a candidate for anxiety medication or therapy from a healthcare professional. If a parent feels unsure on how to deal with a child's anxiety and fears, consulting a pediatrician is a place to begin. The first step in handling anxiety in children is to determine whether the child is experiencing normal childhood fears or something more serious. A few common forms of anxiety in children are fear of the dark, concerns over going to school, fear of strangers, or separation from parents. A boy or girl with extreme and recurring anxiety is, however, likely to be suffering from an anxiety disorder, particularly if the symptoms include less common indications like panic attacks, obsessions, or compulsions, i.e., uncontrollable urges to perform repetitive or irrational actions. A parent can choose to handle normal childhood fears by remaining calm and encouraging the child to verbalize his or her feelings. Even if the fear is irrational, it is real to the child, and the child's caregiver should meet these fears with understanding and patience. A small child might benefit from a storybook where the main character is battling similar challenges. Another widely used tactic for handling anxiety in children is role-playing, where a parent can teach the child how to react in a scary situation and they can practice newfound skills with each other. Talking about fears together, teaching the child to manage his or her anxious feelings, and modeling confidence while remaining supportive, are all common ways of dealing with anxiety in children. Although disorders like obsessive-compulsive disorder, social anxiety, and panic disorder are popularly assumed to be adult conditions, children can also be afflicted by their symptoms. If there is suspicion that a child might be suffering from severe anxiety or an anxiety disorder, the caregiver should contact a physician or mental health care professional experienced in dealing with anxiety in children. Children with severe anxiety can also often benefit from talking to a counselor. Compulsions, panic attacks, and obsessions are frequently treated with anxiety medication. Caregivers and healthcare providers can work together, discuss benefits and risks, and determine the appropriate course of therapy for each individual child.